please welcome to the stage Dr. Chelsea Clinton.
Thank you and good afternoon. I hope that my esteemed panelists will walk on stage while I introduce them. I'm really looking forward to this next conversation as we talk about the Aurora Prize, and so would like to formally invite to stage Armine Afeyan, the CEO of the Aurora Humanitarian Initiative, and Dr. Iftikher Mahmood, founder and president, Hope Foundation for Women and Children in Bangladesh. Thank you. Armine, I want to start with you. For people here who may not be familiar with the Aurora Prize, can you share a bit about kind of the broader foundation's work and how the prize is connected to that work?
Absolutely. First of all, thank you so much. It's an honor to be sharing the stage with you, Chelsea, and with Dr. Mahmood as well. And I want to congratulate you and welcome you to the selection committee of the Aurora Prize. It's an esteemed group. I have to say, usually our initiations are a little bit more low-key, but I like your style. So Aurora really started about 10 years ago. We were at the centennial of the Armenian genocide. My name's Armine. It's no secret. I'll be Armenian. And there were three founders that were contemplating what to do. For anyone with that kind of an unenviable inheritance legacy, it looms large, as intergenerational trauma tends to do. And so at the centennial, there were these three founders that came together. They were Dr. Vartan Gregorian, who stewarded such internationally known institutions as Brown University, the New York Public Library not far from here, and of course the Carnegie Corporation at the time of his passing a couple of years ago. Ruben Vardanyan, who is a prolific philanthropist in Armenia and entrepreneur, and Dr. Aurora Afeyan, who's probably best known, he's a scientist entrepreneur for co-founding Moderna. I like to think he's best known for being my dad. And so they came together and they decided to repurpose the legacy of being a survivor. You don't get to choose that, but you do get to choose what you do with it. And they decided that gratitude in action would be their rallying cry. Aurora was founded on the principle of gratitude in action, the deep sense of gratitude that you feel when there is someone in history who has stepped in and enabled you to survive and even thrive. For my family, for me, that was 2 German soldiers who broke rank during the genocide, pulled my great-grandfather off of a train to the desert and certain death, and gave my family a second chance. And there have been some things of global consequence that have happened as a result of that. I grew up knowing deeply that sense of gratitude and really feeling, even if I didn't always act like it, that every day was a gift from those soldiers. Their descendants are somewhere out there. They probably have no idea what they did, but I do. And so that's what the Aurora spirit is. The way that Aurora works is that every year a humanitarian, a grassroots humanitarian, receives $1 million. Some of that goes directly to them as an award, continue their work. Most of it, they actually reallocate. So it's a participatory grant. And that's founded on the premise that they are the best positioned to decide how that capital gets allocated locally. We are through and through a localization organization, and that's how the prize gets distributed. The other thing to know about Aurora is that we go through a rigorous selection process. This is how we take the onus on us. We don't bog down humanitarians in paperwork. We want them to be able to do what they do best. And I think the thing to take away from this is the human in humanitarian. That's what we're all about. I'm going to tell you a couple stories of humanitarians just to give you a flavor for that. Dr. Tom Katina is in the Nuba Mountains of Sudan. He's been there for almost 20 years. When everyone else pulled out, he stayed and he's built a teaching hospital. He was our 2017 laureate. He has a catchment area of 750,000 people in a region the size of Austria. Another, Sayeda Ghulam Fatima, was a 2016 finalist. She's liberated 80,000 bonded laborers in Pakistan. I will always remember as a finalist, in part because on March 16th, 2017, you might not remember this, but you had a Facebook post congratulating her because she was also a winner of the Clinton Global Prize. And about 5 minutes later, halfway around the world, a team of fledgling Aurora Initiative employees, my team included, absolutely lost it. We were so excited for that recognition for Sayeda. So thanks for seeing what we were doing so early on.
Well, to quote my mother, it certainly takes a village. I really, though, am so struck, Armine, by kind of the not only kind of purposeful gratitude and action at scale, but also with a generational perspective, right? Even in the examples that you just mentioned, kind of the building of a teaching hospital and the liberation of bonded laborers, not only in a way that will affect their own lives, but also the lives of their children, their grandchildren, and in generations to come. You know, Dr. Mahmood, I wonder if you too could share a little bit about kind of your origin story, kind of why you kind of are in the work that you're in, and kind of what you want our audience to know about the work of the Hope Foundation for Women and Children in Bangladesh.
It's a great honor to be here today, and thank you for asking. It's a special day for me. I think I was not prepared for this. There will be a surprise presence of our head of the state, our role model. Every Bangladeshi look up to him, Professor Muhammad Yunus, His Excellency. And so this is special, became a special day. I've been living in the US for quite some time now, over 30 years. And I'm from Bangladesh and Cox's Bazar, which is near the Myanmar border. When I was growing up, I saw the woman, the mother's health, women's health, and a lot of women would deliver the babies at home in the hands of traditional birth attendants. And as a result, there was a high maternal mortality and neonatal mortality. And when I was growing up and studying medicine, I have seen firsthand the suffering and the devastation. So I wanted to do something about it because these deaths, I think, was mostly preventable deaths with some early intervention, prenatal checkup, and all this. And so I thought that I was very motivated. I would do something, but I was not ready for it at that time. So after my graduation, I came to the US. I've been exposed to the US medicine. I was trained in Cornell and Brooklyn Hospital. And when I settled down a little bit in 1995, I started Hope Foundation for Women and Children of Bangladesh with a mission to reach the marginalized women and children. Started my area and give them compassionate care and give them a chance. So I started very small. I started with one room and a part-time physician. I supported from here, and I focused on maternal health. The reason is that I felt all the time that if we can keep the mothers healthy, that the whole benefit, the whole family will benefit from it, and the whole society will benefit from it. So that's how I started. Over the years, I've been able to build like a network of hospitals and clinics in southern part of Bangladesh, in Cox's Bazar area, and provided the needs, provided the care the community needed, like with the special, with the skilled birth attendants, emergency obstetric care, and community education. In 2017, our country faced a serious crisis, humanitarian crisis, when almost 800,000 Rohingya people came from Myanmar, fleeing violence and genocide. And they came to Cox's Bazar, where I've been working. My team has been working for a number of years already. We have built hospitals already. So when they came, and before anybody, thousands of people from all over the world, good people, volunteers, donors, went to Cox's Bazar, but it took a little bit of time. But we were there, understanding the dire situation. Our team immediately moved on, entire team immediately moved to the camp and started setting up health posts and clinics. Eventually, we built the largest field hospital, the Hope Field Hospital for Women, which became the beacon of hope for that Rohingya community. And especially that every sick woman that inside that camp that who other people are not able to manage, they would send to our hospital. It became a referral center. And the thing that helped us is the building the local capacity. So when I started the program, I realized that I didn't have the tools, I didn't have the human resources to provide that kind of service. So in 2012, we are one of the first in Bangladesh to start midwifery school. So we recruited women from the local community and the young women from the local community, the basic education. We gave them 3 years of diploma training, and which is already still continuing. And by the time the Rohingya crisis happened, we had almost 100 qualified midwives trained. So when that crisis happened, they went in the line of care, along with the Hope Foundation team. They have saved thousands of women's lives, because that time, that kind of help were not available at that. In a few weeks' time or few months' time, a lot of people went there, but the refugee community, most of the women and children, right? And they are very vulnerable. So this, along with the Hope Foundation, doctors and nurses and everybody else, and including myself, and the midwives, they saved thousands of lives, and we are very thankful to that. And that is what helped us to grow as an organization from that experience, grow and continue that work. And I'm happy to share that experience with this audience today.
And Dr. Mahmood, do you have any sense, you just mentioned, the thousands of women from the Rohingya kind of refugee community that kind of your Hope Foundation community of midwives and nurses and doctors were able to support and help save their lives. Do you have any sense over the last, not quite 30 years, but from 1995 till today, how many women and children's lives you've impacted in Bangladesh?
Absolutely, because right now, as I said, I started with one room and one part-time doctor. Now we have an army of over 500 people who work with us. We serve 500,000 women and children every year. And over the last 25 years, obviously, millions. And not only that, with this midwifery program that we started, it has been a wonderful program. And because these women that joined this program, they are from rural communities and poor families. Now they're not only saving lives, they're supporting their own family, and they elevated their status in the community. They are very respectable profession. Now, all over Bangladesh, they know about midwives. And following that time, there are many other institutions started midwifery profession. And one of the things I would like to say also, that I don't know our audience about one condition that we specialize in Bangladesh is taking care of patients with obstetric fistula. It's very common in African areas and as well as in Bangladesh, but it was not very well known. But because of the midwifery program and our activities around it, now in Bangladesh, there is a great movement about how to take care of the women with obstetric fistula who suffer from years and years and years until they get a surgical care. At Hope Foundation, I'm happy to say that we build that capacity to train surgeons and who are able to take care of the obstetric fistula patients. We have done over 1,000 cases for free with the funding from our donor organizations like Aurora Foundations, Fistula Foundations, and other donors that we have, so that women get a chance. And many other programs we do, but we focus on women's health.
It's just extraordinary. Please give Dr. Mahmood a round of applause, because I think, sir, your story so exemplifies the ways in which we kind of fundamentally believe, because of a lot of data, that durable and sustainable generational change starts, right, with one person from a community starting with what they know, and then that kind of, the light of that optimism and gratitude and action attracts others, and then you have true impact at extraordinary scale and readiness to respond in crises. And it's just incredibly not only inspiring, but also instructive. I mean, I wonder, in our last kind of couple minutes, if you could share, since you've been on this journey now for a decade and you have, through the Aurora Humanitarian Initiative and the Aurora Prize, had the chance to meet many extraordinary people and to support their work through recognition and funding and connectivity, including, of course, Dr. Mahmood. Are you looking for different things today than when you began 10 years ago? Or are you still looking for the same qualities?
It's a great question. The fundamentals remain the same. So that founding story, the example I gave of my family story, that exists, across the Armenian community, but across the world. And someone risking their own life to save others, to give others a chance, those are the people that we're looking for. Those are the people that we need to be there for. And so through that network that's built as a result of the prize selection process, those folks have impacted tens of millions of people around the world. Aurora directly has benefited 3.4 million people across 430 projects in 56 countries. But what I think is more extraordinary is the individual stories. And so that is, we look for a similar set of things. We make sure that we are cultivating representative stories from around the world. Small plug, the nominations process is open. If anyone has any extraordinary stories, please do nominate. But the core remains really the same.
So in our last few seconds, I would like to underscore what Armine said. Please do nominate extraordinary people that you may personally know or whose stories you may have heard for the Aurora Prize consideration. Please learn more about Dr. Mahmood's work and ways in which perhaps you could continue to support kind of expanding their reach in Bangladesh, and also kind of how his model might apply to your own communities and kind of spheres of work and influence. And kind of ending again on the point of gratitude and gratitude in action, please give our panelists a round of applause. Thank you very much.